Welcome to the Growth Lab, the podcast dedicated to the business of beauty and vitality. Today, we're sitting down with Jessica Baladad, the founder of Feel for Your Life. It's an amazing application that features breast health. Let's find out more. This episode is brought to you by MedSpa Accelerator. We help med spas and weight loss clinics solve the bottleneck of inconsistent, unqualified patient leads to achieve a predictable, scalable monthly revenue without staff burnout. We're absolutely thrilled to have Jessica join us to discuss the future of patient care and these unique testing methods. Let's get started. Good afternoon, Jessica. How are you?
I'm fantastic. How are you doing?
I'm doing great. I'm excited to dive into your story. I like to frame these conversations simply past, present, and future. Okay. So we'll start with your origin story, your background, how you got into, where you are as a result of, your past. And then we'll pivot to present reality. What's working? What's causing friction? What's keeping the doors open? And then we want to look at future outlook, which is your vision for the next 3 to 5 years, if that's Feel for Your Life, or maybe it's something else. Maybe you're planning some bigger strategic moves. And that way we'll cover 360 degrees, full spectrum of building out a successful business. Does that sound like a good roadmap?
Sounds fantastic.
Excellent. Well, I think everybody wants to know a little bit more about you. I have read personally a lot about your experience, and it's really taken shape to help others seek risk reducing measures against breast cancer. Please tell us about the app.
So I'm from Nashville, Tennessee, and when I was 33 years old, I found a lump in my breast while performing a self-exam. And when I went to the doctor, they said, you're probably too young for breast cancer. But plot twist, I was not. It took me 4 months to get a proper diagnosis. And part of the reason of that is that insurance companies recommend screenings starting at 40 years old, or that's when they'll start paying for them. So young women often have to jump through hoops to get mammograms and ultrasounds. I thankfully advocated for myself because I had a history of doing self exams. I was very aware of the prevalent cancer history in my family that I was able to get a mammogram eventually and a proper diagnosis. Like I said, it did take 4 months, but I was diagnosed at stage 2B, which was early ish, I guess. Went through chemotherapy, radiation, multiple surgeries, but I am grateful to be here today as a 7-year breast cancer survivor.
Wow, congratulations. That's got to be a pretty great feeling, right?
It's fantastic. Yeah.
And so, just so everybody else is on the same page, as a result of that experience, that's how you built out Feel for Your Life, which is empowering and changing women's health. Is that correct?
Yeah, so I was going through chemotherapy and I came out to my friends on social media and said, "Hey, if you see this bald baddie walking around, that's me. I've been diagnosed with cancer." And everyone, of course, freaked out. "Oh my God, how did you even know to get checked?" And I said, "Well, I do my self exams every month. Don't you?" And they were like, "No, no." And I'm like, "Oh, this is an issue. I thought, we post about our health, but not that doesn't always translate to what we're actually doing." I often say, if you're gonna Instagram your breasts, mammogram them too. Girl, do both. If you feel good and look good, take care of yourself too. And it's just a lighthearted way to talk about breast health. And I started a social media campaign called Feel for Your Life. I set up a Facebook page and an Instagram page, and I just started talking about doing self exam. And the word got out. But then during the pandemic in 2020, when we went under quarantine, I was working on a campaign with the NFL, their Crucial Catch campaign. And
Okay.
that's when I learned that women were being diagnosed at later stages because they were missing their screenings. And I thought, I want to do something about this. I want to get the word out about self exams and blow this up and just make sure women know that they still have some control over their health in a time when we didn't know what was going on. And through that, I started putting feelers out there. I'm like, who knows how to make an app? And I met a mentor, and this mentor said, I can either do this for you or I can teach you. And I'm like, I want to do it. I want to be the one to do it. I want to say that I built this. So he showed me everything that I needed to know and taught me what I needed to know. And I just used my background in marketing and my love for technology put everything together, and I created Feel for Your Life, an app that shows you how to perform self-exams. It lets you track your progress and set monthly reminders so you never forget. And then through that, as the emergence of AI came to be, I thought, I'm going to make an AI component of this. As women are doing their self-exams and getting screened, I want them to understand the results that they get from their mammograms because it's often written in medical jargon that you don't understand the medical jargon that you see in your reports.
Mhm.
So I thought, I am going to build a portion of this that can take your mammogram reports and translate them into terms that a woman can understand and give her questions to ask her doctor so she's not left in the dark about her results.
Wow, that's really impressive. And I didn't know that you had such a strong background in marketing and public speaking and brand consulting and healthcare consulting. That's pretty impressive. So now that the app has been built out, how many downloads has it had?
I've amassed over 200,000 at this point.
Oh my goodness gracious. And just so for the record, it is free, right?
Yes, it is free to use and download, absolutely.
Okay, great. What's now that that's pretty much good to go and it's really breathing of a whole life of its own, what is next on the horizon for you now?
I want to create a Feel for Your Life 2.0 that's more intuitive to the user experience and helping a woman navigate her breast health a little bit easier. I'm also working on campaigns that I don't want to say it's political. I mean, it can be interpreted as political, but I am getting more involved in healthcare policy to bring both sides of the spectrum together. This is bipartisan to bring together red and blue to make purple to understand how to bring more transparency, accountability, and ultimately affordability in healthcare so that the systems are created to understand the patient experience better so that the gaps are closed and women aren't falling through the cracks when they're trying to get care for their breast health.
Yeah, that sounds like a huge challenge when you're trying to bring two sides together like that. And I know that obviously healthcare affordability is a very big issue right now. It's some people are paying through the roof. So I can definitely understand and appreciate that. You also offer other services as well, though, other than just app development and healthcare consulting, right? You also do growth marketing, lead generation, digital marketing. Tell me about some of the clients that you've worked with in the past.
I've worked with healthcare companies to execute plans that allow them to seek better audiences with a human component, especially behind my breast cancer story. It's powerfully told. I tell it very well. I also activate other advocates and other women in the breast cancer community to tell their stories effectively to be able to improve or forward initiatives of healthcare companies that they seek in their goals for growth and development. So I help, I don't want to say train, help other advocates, other women feel comfortable with their story in promoting that on social media, kind of massage it a little bit, just kind of foster
Yeah.
in them, and I take a very human approach to it to show, inside of healthcare because people see, like, white coats, they see very medicalized images, but we often forget that there are very human outcomes that we ultimately wanna see and that we're comfortable with when we can relate to those stories.
Wow. Okay. Yeah. That's very interesting. And what is the biggest goal for the business in 2026?
To continue to grow the app and the downloads and to acquire more sponsors and to get more support behind that to forward healthcare policy in different areas and avenues. I've got some plans I'm kind of holding on to, keeping close to me right now, but there's a lot of conversation happening and how to promote some of these issues that are happening right now amongst the noise going on in our healthcare system. Basically, if there's any way to bring people together, no one likes insurance companies unless you work for one. And
True enough, Jessica.
right. So it's really holding like plans that would hold them accountable to some of the things that have happened in the past and to ensure that it doesn't happen in the future.
Yeah. Absolutely. So you mentioned one of the goals for the app was to streamline and move those downloads from 200,000. Do you have a number on that goal? Is it like 500,000 towards the end of the year?
You know, I my prayer every day is that I reach the people that I'm intended to reach, and as I tell my story and I'm promoting it on social media and I'm on a stage and I'm speaking or I'm doing a podcast, it's very easy to generate growth organically and because of the power of storytelling. So
Mhm.
I'm very optimistic that no matter what I do in promoting that, that it's gonna generate the growth that it's, intended to generate.
Okay. Yeah, I like to clearly define goals, right? Because how do you know you're gonna get there if you're not knowing what the end result is gonna be for you, right? So I just like to clearly spell that out so I know exactly how I'm tracking that progress towards that goal. That's all.
Yeah. Thing, to add to that, like when I am tracking progress through the women I know in the app who are doing the self exams, who are getting screened and monitoring that in the app as well and using the AI. So I have my analytics that
Oh.
show that growth and there are incentives within the app that promote people to continue to use it. So as far as, the goals, the more concrete things, they're definitely there, but sometimes we say, "Oh, I want 1,000,000 downloads." It's not that number sounds really great, but the results that I'm really looking at are the women who are taking action. We always hear about breast cancer awareness, but it's like, what are you doing after that? Are you actually we're aware that we have breasts, we're aware of cancer, but what are you doing? What action steps are you actually taking to ensure that you're taking care of your breast health? And those are the things that I'm ultimately tracking. So by improving things within the app and the user experience and the interface and how users engage with the different things inside of the app. Those are the things I'm most importantly tracking overall.
I wanna see this thing, even though I'm not a woman, I would love to download it just to see what it's like, so it's gonna be feelforyourlife.com. You can also find it on the Play Store and the Google App Store the Play Store and the App Store. Make sure to check a link in the description down below. So, definitely we wanna help Jessica get her downloads up. Now, if you look at the current, I wouldn't say patient acquisition process. I would say customer download process. What is the first point of friction or strain that your team feels every day?
Strain or friction. Usually has to do with the App Store or the Google Play Store. Some things that are not necessarily that are out of my control. But, usually there's something that I can, if there's a piece of information that someone is seeking by downloading the app, we're on top of being able to facilitate getting them what they need. Sometimes it's a matter of a soft reset, but just turning your phone off and turning it back on, clearing your cache, clearing your cookies, things like that. Expected to be tech savvy, but we aren't all the time. And sometimes doing the simplest things can help remove some of those roadblocks. So, as far as like downloading the app and some of the friction points there, it usually has to do with something in the Google Play Store or the App Store.
Okay. And you are a C3 nonprofit, right? For Feel for Your
I am
Life?
not actually Feel for Your Life is a registered LLC.
Okay, I actually wasn't sure because since it is a free download, I wasn't sure how that worked actually on so how do you generate revenue from it?
I have sponsors and not all of them are forward facing.
Okay, I get it. All right, so it's kind of like a behind the scenes kind of sponsorship kind of deal. Okay, interesting. I wanted to know if you could eliminate one time sink or one repetitive task that you feel every single day that prevents you from really diving in and accomplishing your goals every day. What would that be?
Government bureaucracy.
Government. Great answer.
Government bureaucracy creates so much redundancy that is absolutely unnecessary, and it drives up cost and makes things more opaque. So that is something I deal with every day. And
Now,
so
how can we help you cut through that red tape, Jessica?
your state representatives and your senators.
Fantastic. What systems do you have in place that takes, somebody that's just kind of like, maybe browsing through, the internet and they see your app or they see your website and they're saying, okay, cool. How do you make sure that those systems are in place to turn that person into a person that continuously returns for multiple that keeps it on their phone and doesn't uninstall it, right, throughout the year, right?
So you start like, with the acquisition process in place. And so when you come to the Feel for Your Life website, I start with the copy and I start with the visuals that keep your attention and that give the value propositions up front right away. So you know what you're getting and you know what you're doing and you know why you're there. And then, there are calls to action set up for you to download the app easily. And then, like I said, sometimes there are some issues in the App Store, Google Play Store, keys cache, this and that, that might prevent a download. That happens every now and then. It's really not that often, but if there's an issue, that's usually where it is.
Okay.
Yeah. So then from there, you download the app, and then inside there are again prompts to help you navigate and tell you exactly what to do. And I don't mean this to undermine anyone, but I thought about if I wanted my grandmother, if I had to spell this out in crayon for someone to use, I mean, there are buttons that say start here, do this. Everything is clearly labeled and clearly defined. And there are prompts for you to set reminders for doing self exams, for getting how to come back to the app. It's loaded with information that keeps you engaged so that you want to come back and engage and interact on.
Okay. Okay, that's great. And what about is there if there is a detection, right? Or if the app doesn't report detection, obviously that they self-report that information, right? Or if there's
Correct.
a lump or something like that, what measures are there within the app for them to go take action? Because obviously getting there early is the most important thing, right? So
There are
how do they get to their connected provider from there? Is
yeah,
there a
so
way to streamline that within the app?
that's a great question. Anytime a woman finds a lump in her breast or something that's abnormal or outside of what she recognizes to be normal, there are prompts inside the app that say, make sure you talk to your doctor, document here, call your doctor. Inside of the AI app, the AI portion, if someone starts using the AI for, asking it questions, I created prompts for them to find a doctor that is close to them. Certain phrases that I've become familiar with and that I often see as women are using the AI feature, if they're asking medically based questions, this is not a doctor, this is not medical advice, but if you're looking for a doctor within your area, tell us where you're from, and then it takes you through prompts that'll help you locate a doctor for yourself.
Okay, so it will eventually. Maybe that might be in version 2 that you're developing right now where it actually connects to their provider. What do you think about that? And that maybe that's the red tape that you're trying to get through right now.
So it will give suggestions on where you can go to the doctor, but as far as connecting you straight to a doctor, that's that's a whole lot of HIPAA, a whole lot of legal, a whole like it would involve getting involved with like an EHR, and I don't know if I want to be there yet because of
Yeah.
all of the red tape and the legalities. And it's like if I'm jumping through hoops, I mean, the easiest way is, for to create a prompt for the woman to call her doctor right away to make that appointment. Why
Yeah.
through different interfaces and different systems when I can create prompts that say, call your doctor, take action right now. That may be the easier solution for that.
I think you're absolutely right. I think that is the easiest solution. Obviously, something that is more usability would be if maybe that's reported on the app that they found a lump, and then maybe their insurance information is already on the app, and it automatically notifies their doctor, and then their doctor schedules a consult with them automatically. And that would be really cool, right? Obviously, but I'm just thinking out loud.
Yeah, I probably wouldn't wanna hang on to someone's insurance information. I don't think that's necessary for me to do, especially at this point. I don't really see that in the future because that's something for their doctor to hang on to. If anything, if a woman doesn't have insurance, if you go through the AI prompts right now, it will ask you, "Do you have insurance or not?" And if you don't, it'll connect you with services. When I say connect, it'll list out, addresses and phone numbers for you to call it
Okay.
to get screened if you need to. So there's an option like, do you have insurance or will you be using insurance? Just so it's like, okay, we can either find you like a provider based on your insurance, based on, or I should, based on whether or not you have insurance, or if you don't want to take a self-pay option or a free option, or how to get access to a nonprofit that can provide you with a grant or an accessible way to get screened.
That's fantastic. That's great. That's really great resources that are in there. And it seems like there's more and more updates, obviously, that are always being, just like any app that's on any Play Store, you can easily update that. And then it's got those new features already built in, right?
Right.
Okay,
Yeah.
that's great.
In 2.0, because I see how women are using the AI, I want to streamline the AI part of it to make it just a little more simpler because everyone's inundated right now with AI. It's very saturated. Use this AI tool, use that AI tool. And to some extent it can be kind of intimidating and it just confusing. So I just want to make the prompts easier to make the information more accessible to the person using it.
Does it use voice, Jessica, or do they type it in?
It does not use voice at this time. They can
It'd be cool if they got it to voice and then they could just talk to it like Chat GPT, right? And then they could just say, "Hey, what do I do now? Where's the nearest clinic?" Or, that would be are you building that now out in version 2?
So, I don't know if I'm gonna incorporate voice because, I mean, all of these things, they sound great. They sound so cool. It sounds really neat. But when you are, again, it's just more hurdles you gotta jump through, more legalities, more red tape. It's like, now we're going to be, you know, someone's going to be talking to the app. Now we need to be authorized to use their microphone in their app. And now we need to do, and it's just like, I just, so much of healthcare is already jumping through hoops and hurdles. How much do I really need to complicate things when I'm just trying to get a woman to advocate for herself in the easiest way possible? So that's what I ultimately think at the end of the day. It doesn't have to be hard or complicated. It has to be intuitive. It has to make sense, but it doesn't have to be everything to everybody necessarily. But I mean, I love the ideas overall. It's just my brain starts to think, okay, that's great, but what is the ultimate goal? And does this stop anything? Just one more friction point, can we access your microphone? Can we access this? Can we blah, blah, blah. And if the woman sees all these prompts from her phone saying, it's going to make her think, is this something I can try? Why do I have to keep giving permission for all of this stuff? I think people are very cognizant of their privacy and their security right now. And
Mhm.
it's very important for me that a woman still feels like they have autonomy in using technology. So it's a good idea, but I also have to think about the end user experience and the ultimate goals.
Mm. Yeah, that's a very interesting perspective. I didn't think about it like that. So you think that, like, for example, what you were just addressing, certain pop-ups may turn off that audience if they're simply asking for that permission. That's a very
Right.
interesting perspective.
Yeah, because I already have to there are location settings on there currently. Because if you're gonna find, for example, like, would you like us to search for a mammogram provider within 60 miles of where you live? Most of the time, like, when someone downloads the app and it asks for your location, that's Google or that's Apple, and I
Yeah.
most of the time, I really don't need it's not me who's asking, it's those apps that are asking for permission, and people think, like, "Why does feel for your life need to know where I am?" And so it's just, there are getting through the barriers of what may break someone's trust. I never wanna compromise someone's security or break someone's trust because of using my app because it's based on my story. It's based on my reputation and,
Mhm.
reputation's everything. And what's made the app so successful is that people relate to me and my story and my breast cancer experience, and you know, people relate to people, and so it just means a lot to me that women this far have trusted me in their advocacy with their breast health.
Well, I really do appreciate your story, and I think all of your audience and all your users that are on the application really do appreciate your story and the user experience. And so is really, really fantastic. And it's been a great breakdown, Jessica. I think And thank you for being so candid about your specific experience and about the usability of the application itself. I think we've actually covered a lot of ground today from your origin story to the future of breast cancer awareness. And I know that our audience, especially the women, will get immense value from this. And with that, we're going to go ahead and wrap up the recorded portion of the Growth Lab. Thanks for tuning in. Bye now.